According to Food and Drug Administration Director General Eric Domingo, they have received applications for the EUA revision for the use of COVID-19 vaccines of Pfizer, AstraZeneca, Sinovac, Janssen, Moderna, and Sputnik V. According to Domingo, they have tapped the DOST Vaccine Experts Panel to review all of these documents, and they expect to release or issue the results of this review in 1 to 2 weeks. Domingo also said it could be possible that there will be a revised EUA even prior to November 15, by when the government eyes to start the booster rollout here in the country. Sean?
Right, Greg, let's just clarify. Will this amendment allow vaccine makers to issue third doses? This is, of course, different from booster shots.
Yes, Sean, that is correct. The EUA amendment will also include the possibility of allowing a certain brand of vaccine to be used as a third dose, as it is also different from the use from being used as a booster. And once an EUA or once an amended EUA is released, it will be up to the Department of Health or the government on how and when are we going to use these vaccines as either booster or third dose for the healthcare workers, for the senior citizen, and the rest of the priority group or the rest of the population. Sean?
Right, so are there extra stipulations, Greg? Like, for example, once there is a green light to roll out booster shots, should people or are people compelled to get the same brand as they did in their first 2 doses? Or is mixing and matching allowed in certain, at least with certain brands?
Sean, we've also able to talk to Dr. Kongki Lim Kizon, member of the National Immunization Technical Advisory Group, and according to her, their recommendation at the moment is for the homologous vaccination strategy, which means the booster of an individual would be the same brand of the doses that he or she has received as his or her first or second dose, but from the interim recommendation of the Health Technology Assessment Council, they also have this recommendation of having homologous and heterologous or using other brands as booster or third dose for an individual. According to our experts, it will all end up to the Department of Health and to the availability of vaccines, if whether we can use other brands or we can just use the same brand as it is the only available supply that we have. Sean?
Right, so everyone's a little bit confused about this at the moment. Greg, will there be additional guidelines released or to be released in order to inform the public better on what they can expect with this booster shot or third shot rollout?
Yes, Sean, according to our experts and even the Department of Health has previously said that we still have to wait for the complete recommendation of the WHO Strategic Advisory Group of Experts for Immunization for us to know or for us to align our booster rollout to the recommendations of the WHO SAGE. And aside from that, the Department of Health is expected to issue a final protocol on how and when we can start the booster rollout and the use of third dose here in the Philippines. Sean?
All right, last question, Greg. Any idea when this will start? Is there a timeline?
Sean, for the booster rollout, we've heard Secretary Carlito Galvez Jr., or Vaccine SAR, mentioning the government is eyeing to start the booster rollout by November 15, and the protocols or the guidelines might be released by November 5 or tomorrow. But this will all depend to the availability of a vaccine having an amended emergency use authorization. And as we've talked to FDA Director General Eric Domingo, they are expecting to have results of their ongoing review in 1 to 2 weeks. Sean?
All right, looking forward to that. Thank you so much for all those updates. Greg Gregorio reporting to us live from Mandaluyong City. Stay safe, Greg.